I am 51 years old, planning to get dental implants. Can I get an all-on 4 or should I get an all-on 6? Which one is better? The short answer is it can be either way. It can be an all-on 4 or it could be an all-on 6. So that depends on who is going to do it and why they recommend you do it in a certain way. So I have patients in my office. I do all-on 4 pretty much all day, or sometimes I do an all-on 6. For those who may not be familiar what an all-on 4 or all-on 6, this is, for example, you got 4 implants in this model, 1, 2, 3, 4. You do the prosthesis on the top, either fixed or removable, that becomes an all-on 4. Sometimes you put 6 implants, then you do the prosthesis either removable. More than likely, if it is going to be 6 implants, it will be a fixed prosthesis. You do a prosthesis on 6 implant, that becomes what we call it as an all-on 6. Whether you can get a prosthesis on 4 implants, whether you can only get a prosthesis on the 6 implants, depending on a variety of reasons. What the surgeon feels comfortable, what your oral hygiene habits are, whether you are a smoker, whether you drink excessively, whether you have any medical conditions, whether your dexterity is so poor you cannot do a good job with a particular type of prosthesis you may have, or whether you have good bone support. Those are going to be the determining factors to whether you can get an all-on 4 or an all-on 6. So it is a type of discussion you will need to have with your surgeon who's going to be placing the implant, and with the prosthodontist or the family dentist who's going to be doing the prosthesis, whether you are a good candidate for an all-on 4 or an all-on 6.
So would you say there's any disadvantages or advantages between the all-on 4 and all-on 6?
Not really. What Reese is saying, whether there is any disadvantage of getting an all-on 4 or an all-on 6, both the prostheses are going to be doing the same job. If you are going to get, like, let's say, for example, which is a common fixed prosthesis, you're going to have either an all-on 4 or an all-on 6. There is not really a big advantage of one versus the other. It's just a preference, and like I said, your condition kind of dictates whether you need to have an all-on 4 or an all-on 6.
All right.